Next speaker is Dr. Sachin Matthew George. He's a corneal specialist as well as a cataract surgeon working at Alfonso Hall Hospital and various other hospitals.
Thanks, Dr. Alex, for including me in this session, actually. I mean, my topic is cortical wash and IOL implantation. Like for a successful removal of cortical material during cataract surgery, it begins with the proper instrumentation. IA handpiece is the primary instrument used to remove the cortex and can be performed either by a bimanual or a coaxial system. Right. So this is a bimanual aspiration. I mean, you can see that the irrigation and the aspiration ports, the handpieces are different. I mean, that itself makes maneuverability easier. And as you can see, this is a posterior polar cataract with a PC dehiscence. So in high-risk cases, it is better to use a bimanual, where actually, in this case, like you cannot, you're not hydrating the vitreous, actually. The vitreous is still not disturbed. And then you can do a better cortical wash. So in high-risk cases, it's always better to use a bimanual aspiration. Right. And in a cortical wash with a coaxial aspiration, this is it's a single instrument. You can see that the irrigation and the aspiration ports are in the same handpiece. And you're doing it, the AC is a little more, with the newer instruments, AC will be stable in most of the sets. But this, here we are not making as two paracentesis, and we are finishing the cortical wash. Now, why we need the coaxial and bimanual as two sets, actually? So between these, the two methods, the coaxial prop has there is an intrinsic problem, actually, because both irrigation and aspiration ports are in the same handpiece. So it's an opposing forces in the same, and it's confined into the narrow anterior chamber. So that itself is a problem. But while bimanual, this is not there, because it is unopposed fashion. You can use the irrigation and aspiration in a separate thing. So several high-risk patients like poorly dilating pupil or a corneal endothelial disease, pseudoexfoliation, traumatic cataracts, and like the case which I showed, the PC dehiscence, those kind of cases, bimanual would be a better option. And some of the points, when you should not do fast maneuvers here. Most of the steps in phaco, it's like a continuation of the previous step. Like if you have done a good hydrodissection and a good nucleus disassembly, cortical wash will be easier, but you have to be slow. And wrinkles in the posterior capsule, as you know, you should release the foot pedal so that you're not engaging the posterior capsule. And for thin strands, as I showed, you have to irrigate and then aspirate it later. And you have to select where and when the coaxial and the bimanual has to be used. For the IOL implantation, again, you have to know what sort of IOL you're using, like a 3-piece or a single piece, and whether it is a toric IOL or a multifocal. We have to be thorough with the IOL model and the type. And also the injectors. We have preloaded systems now, and the different types of the injectors, because we should be thorough with the handling and the way you do it before actually doing the right procedure. And again, you can see the video. This is right. This is a toric IOL, actually. Make sure that both the trailing and both the haptics are inside the bag, and then afterwards you can actually adjust the marks as in the toric one. So, and then wash the OVD. You have to actually go under the IOL and wash it also. So those are some of the points you have to use. Right. So careful observation while rotating the IOL and making sure that it's fully within the capsular bag. That's the most important thing. In a phaco, it is not advisable to have the IOL one in the sulcus, the optic one in the sulcus and in the bag. So you have to make sure that it's in the capsular bag, and also should remove the OVD under the IOL. It's from the beginning itself. If you have the habit of going under the IOL and cleaning it, it's better, because later we can avoid the PCO and capsular bag syndrome. A lot of things can be avoided if you remove the OVD from the under the IOL. So these are some of the points you should remember while implanting an IOL. Thanks. Thank you.